Health is the most priceless of all possessions. The care for it and the protection have to start even before a human being is born. And from then on, from babyhood to maturity, health must at all times be guarded and cultivated. And our greatest weapons to do this are knowledge and the use of it. Unfortunately, there are signs and sounds to remind us, even when we are most content, that none is free from the constant threat to health by accident or disease. When medical help is needed, time can often be vital to the life or death of an individual. And therefore it takes a force of trained, competent people, always alerted for any emergency that might arise. Here is a patient being delivered to the General Hospital in St. John's, where a staff of well-trained and experienced doctors and nurses will take care of him. How little, though, is known about the men behind the scenes who created and manage the vast system of public health services in Newfoundland. A variety of problems, which often are more than difficult, have to be solved by the Minister of the Department of Health, his Deputy Minister, and the officials of the department. The nucleus of health services in the community or an area is the hospital. There are large major institutions like the General Hospital in St. John's, the Western Memorial Hospital, and the sanatorium in Corner Brook on the west coast. And there are cottage hospitals, such as this one in Springdale, or the new cottage hospital in Fogo, which was completed and officially opened in September 1952. Extension of hospitals is one of the means of improving health services. Another wing was added to the Hospital for Mental and Nervous Diseases in St. John's in 1951. This new wing brought the hospital's capacity up to 700 beds. Much of the money granted by the government has been spent on professional training for doctors, nurses, and specialists. The Central Pharmacy at St. John's employs many such specialists. Working in close cooperation with hospitals and nursing stations all over the island, this institution acts as a central drug depot, supplying life-saving drugs wherever they are needed. Great responsibility is placed on the laboratories in St. John's, where skilled technicians carry out procedures that are vitally important to the maintenance of a healthy province. They test water, milk, and foods for harmful bacteria, diagnose communicable diseases, make pathological examinations, and in addition act as reference center for all laboratory services throughout the island. The food samples tested in this laboratory are gathered by the Food Inspection Group. For instance, tests are made regularly by skilled experts at the slaughterhouses to ensure us that the meat we buy and serve in our homes is unobjectionable. Milk is constantly checked at the dairies to make sure that it is germ-free and healthful when it reaches the consumer. In this way, harmful conditions are detected before they can become dangerous, and many potential diseases and epidemics have been averted before they could start. A health education program, broadcast to thousands of homes, has proved invaluable in informing the public about foods and the part they play in keeping the body healthy.
Especially one ingredient is found in milk in large quantities, calcium, one of the most essential items for the building of bones and teeth. In connection with this, you must know that 9 out of 10 Canadian children have already been attacked by dental disease, and the average number of tooth surfaces attacked in each mouth is 10.
Health information is very important, but regular care and medical checkups are also a necessity. This is easily accomplished if you live in a city where a hospital has a large outpatients department, like this one in St. John's, or if you live in a community with a cottage hospital or a nursing station. But many of the outports are without either of these services. In a few areas, the mobile dental clinic of the Department of Health travels to outlying settlements, caring for the teeth of children and grown-ups. The children do not look forward to these visits, but to have teeth checked, cleaned, and one pulled occasionally, is nevertheless a much more cheerful prospect than prolonged toothaches and consequent damage to health. One great infection and disease preventative is the method of immunization. To combat particular types of diseases, a toxoid is injected into the tissues and acts as an aggressive stimulant, forcing the blood and the body to build up resistance. In the fight against tuberculosis, an early diagnosis and treatment are vital. Therefore, the mobile X-ray unit of the Department of Health visits schools regularly, and a group of experienced nurses and radiological technicians start the checkups in kindergartens and first grades. The regular checkups for adults, which are equally important for an early diagnosis, are done in the Tuberculosis Control Division of the Department of Health, which has the most modern equipment at its disposal. But in spite of all these protective measures, it is not always possible to prevent a disease, and sometimes medical help and hospitalization are needed immediately. Then another big problem arises, that of transportation. In some parts of the island, especially in northern Newfoundland, for many months in the year, the dog sleigh is the only way of transportation for doctor or patient. Valuable service in bringing medical care to the outports is being rendered by the cabin cruisers of the Department of Health, which operate mainly along the south coast of Newfoundland. Almost throughout the year, they carry doctor and medical supplies right to the patient. The Department of Health's hospital boat, Lady Anderson, usually operates in the Placentia Bay area. Her crew knows every inch of this treacherous expanse of coastline and are expert in guiding their ship to her destination in the most rugged inlets and in the roughest weather, should an emergency arise. Eager groups of people line the wharves, watching expectantly for the familiar shape of the Lady Anderson to come into view. And she barely has time to get moored to the wharf when the first patient climbs onto her decks to see the doctor. More than a medical man, the doctor is a well-known figure in all the communities along the coast, and his visits are awaited with much anticipation, not only for his badly needed medical service, but also for his reassuring presence and advice. The doctor's work takes in everything from a simple earache to an emergency operation. Often he has to go ashore to visit the more serious cases, and if the occasion arises, the patient is brought aboard and the boat takes off full speed ahead for the nearest hospital. So, combining boats, planes, railway, cars, and dog sleds, the Department of Health is prepared for problems of transportation, even under the most difficult conditions, and is able to secure for the patients the help of a skilled doctor and nurses, who are always ready to fight for a life whenever and wherever they are needed. During the year of 1953, over 5,000 patients were admitted to the General Hospital, with a total of over 130,000 days of patient care. 38,000 diagnostic X-ray examinations were carried out. This is a tremendous task for the medical staff. Their responsibilities are great, for upon them and their skill lies the difference between life and death. After a difficult operation and a severe disease, patients often face the problem of readjusting themselves to their days of normal health. Occupational therapy gives them the opportunity to find once more confidence in their manual abilities. In cases where the use of an arm or a leg has been affected by a disease, physiotherapy is being used successfully. Hubbard bath is especially valuable in the treatment of after effects of polio, such as stiff joints. It reduces the pull of gravity on the patient, thereby lessening the strain during the exercises. In the children's ward, care is taken that there is no interruption in education for patients who have to stay in the hospital for a longer period of time. The ward is easily converted into a classroom, and the little ones apparently enjoy their lessons very much in this new and unusual way.
With public health services expanding at an accelerated pace, the demand for more nurses is growing every day. Several major institutions have nurses training schools where girls are being prepared for this profession. In the first year, the student learns the basic duties of nursing, bed making, and taking blood pressure and temperature. The student is not a maid, but neither is she a full-fledged nurse. She is a learner and must learn by doing. In daily theoretical lessons, she extends her knowledge of the basic elements of medicine and anatomy. She studies the various parts of the human body and their functions. Theory is followed by practice, and she learns how to care for sick children, feed them, and how to handle the small patients who, with their limited means of expressing themselves, need sometimes more caution than grown-ups. Later on, the dispensing and careful administration of medicines will be one of her duties, and here, as well as in all things, practice under supervision is the best teacher. The work is new and interesting, and as time goes on, she assumes more difficult jobs with much more responsibility. The life of the student nurse is not easy, but always ahead of her in this study period is the goal which symbolizes the peak of her success, graduation day. Although in our modern age the structure of health services is a most intricate one, it will always be the human being, the doctors and the nurses who are the nucleus of this structure. Therefore, graduation day is indeed one of the most important and encouraging days in the life of a nurse. Many dignitaries, relatives, and friends have proudly gathered to witness the honors being awarded her. They hear the assuring word of the Lieutenant Governor and the good wishes for their career expressed in the minister's speech. See her receive the diploma and pin, denoting that she has been successful in her endeavor to become a nurse and devote her life to the honorable profession of caring for the sick. Awards are given by Lady Outerbridge for outstanding performances and achievements during her training period. Now, fully equipped for the life and the tasks that lie ahead of her, her career really begins. For now she is free to choose where she will work, the kind of nursing she will do. Many nurses remain at the hospital where they have trained and specialize in one of the phases of the profession. But others decide to go afield in the outlying settlements where medical help and nurses are needed badly. So a nurse may decide to work in a cottage hospital. Here, the nervous pressure of life in a modern city is an unknown factor. The newcomer immediately feels the influence of the landscape, the rugged splendor of Newfoundland that lends itself to the very purpose of a hospital, to cure. The warm welcome of the seasoned and experienced chief nurse eliminates her first anxieties of the new and unaccustomed surroundings. And eagerly expected by the sometimes understaffed cottage hospitals, she begins right away her work. it was in the larger, more modern institution, for much more responsibility lies with her. In a matter of hours, she may have to care for a sick child, make notes about the progress of a treatment, or take part in a major operation. Besides that, she has to fulfill all the many duties of a nurse, take care of the outpatients, look after a minor cut, always having a comforting smile for everybody. Again, a different atmosphere can be found in the nursing stations, which are tucked away in remote areas all over the island, and which sometimes only can be reached by boat or airplane. Here, too, the nurses carry on, assuming the responsibilities for whole communities with little help due to the lack of trained doctors and nurses. They must always be on the alert 24 hours a day, holidays and Sundays, to answer any plea for help. She knows that her decisions and her actions must be fast and the right ones, for on them depends often the difference between a life saved and a life lost. Being faced with the problem, for instance, of having a polio-stricken child transported to the capital for immediate treatment, there is in her situation only one way: a wire to the department asking for a mercy flight. The well-planned system of the department proves now its efficiency. Teletype and telephones get into action, and it does not take very long to get the plane underway. A large-scale epidemic of poliomyelitis, as it happened, for instance, in 1953, is the most notable occurrence to be dealt with by the Medical Health Division of the department. In this particular epidemic, a total of 223 cases were notified altogether, and of these, approximately 50% were hospitalized in the capital. This necessitated frequent air ambulance flights, and about 40 mercy flights for polio patients were made at an approximate cost of $9,000. This effective action against the deathly disease was especially valuable for people scattered in communities far from medical care, and planes were ready at any time to run ambulance or medical flights the moment there was a request for help. In the past 3 years, about 400 flights have been made, carrying some 600 patients to hospitals for treatment. These flights have been made in all kinds of weather, and the pilots have landed sometimes in rugged country with just enough space to set a plane down. Many lives have been saved by the quick action of nurses in remote areas and the close cooperation of the Department of Health, the pilots, doctors, and aides, all working side by side in towns, cities, and villages, have assured everyone of health protection. Provincial expenditure on health services has increased from $4.75 million in 1949 to $6.25 million in 1952. The federal government has made available to Newfoundland about $3 million for health services since Confederation. But there is still a great part we can do ourselves, and it is the duty of each one of us to do what we can to assure a cleaner, more healthy life, not only for us, but for our children and for Newfoundland. Health is our greatest asset. Guard it well.